talk now about the components of the Part 2 exam. It's now divided into Viva section, clinical section, as well, and history and communication section. The practical has been taken out, so it's the exam is much easier now than when I did it. The Viva, as you know, consists of 4 main stations: pediatrics, rhinology and facial plastics, otology and neurotology, and head and neck. You will rotate through these sections and you have to talk on each topic for 5 minutes. On each station, there will be 2 examiners. You may also see a third person who's a trainee examiner, and there may also be a 4th person who is assessing the quality of the examiners. As you pass through the station, usually one examiner will ask 3 questions, and the other one, whilst the other one mark your answer, and then the other they will switch, and the second examiner will ask for the 3 questions. They try to cover the syllabus as much as possible so that there's content validity of the exam. With the rhinology, you'll have and facial plastics, you'll have maybe 2 rhinology and 1 facial plastics from each examiner. My advice is to try and make blocks of 6 questions in each section, and then try and learn the answers to those questions. You can use my book. It summarizes the questions very well, and it helps to give you the structure of the exam. Basically, there will be an introductory question, which will start the Viva. Then there's a competency question, and then there's an advanced question. Those are the 3 questions the examiner should ask, but some of them will ask more or try and give you a little bit of help, and some of them will make it difficult for you. It's very, very variable. The problem I find with the exam is that it can be very subjective, in contrast to the Part 1 exam, which was very objective. Once you get the mark, things were either right or wrong, and you get the mark. In this part of the exam, you have to sort of read the mind of the examiner somewhat, and hopefully say the things that is on his mind. They do have a sheet in front of them that guides them through the question, and I've sent this sheet, example of the sheet, to you through the WhatsApp group, so you can see and get an idea of how the questions are structured. There is a set format that they have to follow to give you the marks required to pass. The marking scheme, I will deal with that separate, because that's very, very interesting. It's a closed marking scheme and has specific ways to get the mark. So the history and examination should be taken as serious as any other of the Viva station, because the marks allocated is exactly the same. People spend hours and hours on otology and rhinology, and they ignore history and communication, even though the marks are actually the same. So you must also practice history and communication and take it very seriously. The clinicals is usually short cases, 4 short cases. It used to be very unfairly done, in that there were 2 examiners that would take you through all 4 cases, but things have improved now, and I think there are 2 sets of examiners, so that there's no bias, to reduce the bias involved in the exam. Ideally, there should be 2 different examiners on each station, so that if you don't do so well in one station, it doesn't affect the perception of the examiners of you in the second station. But I think the college is working very hard to make things as fair as possible, and to make the exam as less subjective as possible. Thank you.